Osteoarthritis, arthritis, and fascia. One small caveat, I am not talking about rheumatoid arthritis. So let's demystify the word arthritis itself. It's in Latin. Arthros means joint. Itis means inflammation. It basically is telling you if you get a diagnosis that says you have arthritis, all they've told you is you have an inflammation in your joint. Now your joint could be your elbow, your shoulder, your knee. You could have arthritis in your spine because, right, the spine is a giant series of little joints. So think about it. Let's say, right, I am having back pain and I go and someone tells me, well, you have arthritis. Well, really, they're telling me you have inflammation where you're hurting. Okay, right? Now let's discuss that when it comes to the point of view of connective tissue and fascia. So let's go ahead and give Aaron a fascia restriction over here, right? Because right now, look at his joints, right? Like everything is relatively optimized, right? Lift your arms up over your head for me, right? No problem, right? And then rotate side to side. Yeah, no problem. Both directions. He's got freedom of movement, okay? I'm going to give him a fascia restriction and let's see about that freedom of movement and what happens to it. We're nice and restricted right now. So first of all, let's go ahead and Aaron try to lift both arms up overhead. Yeah, and because I really pulled him. Good. And then drop those arms down. Now, Aaron, go ahead and try to twist your torso to the left. Good luck with that. Now, try to twist your torso to the right. You might be able to go further. You will with this and come back to center. But you can see he lost his freedom of movement. So I want you to imagine where his joints were a second ago when he was upright and not restricted by me. They had freedom of movement and space. Right now, things are quite squished. So yes, he's going to lose range of motion. And as Aaron tries to rotate his torso to the left, go ahead and try, right? Yeah, which it's really, really hard for him. He may be creating some inflammation in his spine, good, at just trying to do that. So let's free him up, get right? Yeah, so let's take a look at that with this little model over here. Due to this model, what we just did to Aaron, we're gonna pull and twist and bend the model, right? And can you see, if I try to move these pieces right now, there's gonna be grinding over here, pulling over here. Things are not back to center, sliding and gliding and happy where they're optimized. So I want you to think, if you get the diagnosis of arthritis or osteoarthritis, which basically involves your bone along with that, right? Bone along the joint, inflammation, that maybe what you need to look at is also realigning your connective tissue to gain that full slide and glide of your joints, right? And of your spine rotation, right? Okay, so just a different perspective on osteoarthritis and arthritis. Don't think it's something wrong with you that you can't do anything about. Once you've got that situation, if you optimize your connective tissue, you can gain all of those ranges of movement and eliminate the associated pain of movement.